Once liver cirrhosis develops, the annual incidence of liver cancer is 1 to 4%. About 1 in 5 patients with cirrhosis will experience liver failure. Hello everyone, I'm Dr. Liu Yuzhi. Welcome Dr. Ming-Lung to the Care Online. Hello everyone, I'm Dr. Ming-Lung. What's the natural cause of hepatitis B virus infection? Hepatitis B virus is mainly transmitted through 2 routes. One is mother-to-child transmission, also known as vertical transmission. Another one is the transmission through exposure of infectious blood or body fluids in adolescence and adulthood. Injection drug use is a main route. In addition, unprotected sexual intercourse can also transmit hepatitis B virus. If children get HBV infection, they will experience an immune tolerance phase, which usually lasts approximately 20 years. During the 20 years, hepatitis B virus can be detected, but the levels of liver enzymes are normal. Basically, liver inflammation is absent in this phase. However, when the immune system matures, liver inflammation occurs, which is called the immune clearance phase. During this phase, the immune system attacks infected liver cells and viruses, leading to HBV flares. Chronic hepatitis B mostly develops during the 10 to 20 years of immune clearance phase. Some people are so lucky that their immune system can suppress the viruses, and in a smart part of them, the immune system can even clear the viruses. But it is rare. Only 1% of patients can do this every year. For most people, hepatic inflammation will continue. The inflammation process will lead to liver damage and even cirrhosis. It is about 1/5 of patients will develop cirrhosis. Once cirrhosis develops, the annual incidence rate of liver cancer is 1 to 4%. About 1/5 of patients with liver cirrhosis will experience liver failure and end-stage liver disease throughout their life. It is so-called hepatitis B trilogy: chronic hepatitis, cirrhosis, and liver cancer. How to assess the severity of liver fibrosis? Among the causes of chronic HBV infection, disease progressed from chronic hepatitis B to liver cirrhosis. During the process, we can divide patients into 5 stages according to the severity of liver fibrosis. Stage 0 indicates absence of liver fibrosis. Other stages of liver fibrosis including stage 1, stage 2, stage 3, and stage 4. Stage 4 fibrosis indicates liver cirrhosis. Before becoming liver cirrhosis, liver fibrosis can be divided into stage 0, 1, 2, and 3. Stage 3 indicates advanced liver disease, and stage 4 indicates liver cirrhosis. How to assess the severity of liver cirrhosis? The simplest way to detect liver cirrhosis is ultrasound. Another device is FibroScan. However, both investigations can only determine whether liver cirrhosis exists. Dr. Liu just mentioned an important point. Liver cirrhosis can be divided into 3 classes according to its severity. The first class is called Child-Feel Class A, which indicates well hepatic function reserve and compensated liver cirrhosis. The second class is Child-Feel Class B, which indicates intermediate degree of liver decompensation. The Child-Feel Class C indicates end-stage liver disease and liver transplantation is necessary. The Child-Feel classification system incorporates 5 variables. These variables include serum albumin and bilirubin. Prothrombin time, ascites, and encephalopathy are also variables of Child-Feel classification. We use the 5 parameters to obtain a score and assess the severity of liver cirrhosis. When should patients with chronic HBV infection receive treatment? If patients are still in the immune tolerance phase and the levels of liver enzymes are normal, which means the liver has not been damaged, no treatment is needed. Why? Because the effect of treatment is not good and is not necessary. If patients are in the inactive phase, the viral load is usually very low. The liver enzymes are within normal concentrations. These patients are recommended not to receive treatment. The golden period of treatment is the immune clearance phase. During the immune clearance phase, patients can be divided into several categories. The first category includes patients who don't have liver cirrhosis. For these patients, the assessment of liver fibrosis is necessary. If the fibrosis is mild, stage 0 to stage 2, it is necessary to check the serum viral load. Generally, treatment is recommended when the viral load is higher than 2000 IU per milliliter. In addition, the levels of liver enzymes are taken into account. The concentrations of liver enzymes need to be higher than 2 times of the upper limit of normal. If one patient meets the 3 criteria, treatment for HBV infection is recommended. For the patients with severe fibrosis, such as fibrosis stage 3, treatment for HBV infection is recommended when serum viral load is more than 2000 IU per millimeter, as long as the concentrations of liver enzymes are abnormal. It is for patients with moderate degree of liver disease. For patients with liver cirrhosis, once the HBV is detectable, regardless of the viral load and liver enzymes, immediate HBV treatment is recommended. What drugs are used in treating hepatitis B virus infection? Currently, there are many 2 classes of medications for HBV. The first class of medicine is interferon. Interferon is administered by injection. It had been used for hepatitis C virus infection. The frequency of injection is once a week. The duration of therapy is 6 to 12 months. Another class is oral antiviral drugs. Patients take antiviral drugs once daily. It is convenient. What is the duration of therapy? It depends. It depends on the condition of patient. Generally, the duration of therapy is usually more than 3 years. Some people need to take this medicine for their lifetime. The mechanisms of the 2 classes of medications are different. Interferon has the effect of both antiviral and regulating immunity. It triggers the immune system to remove HBV virus. The main function of oral antiviral drugs are suppressing HBV virus and reducing liver inflammation caused by the virus. HBV treatments can greatly reduce the risk of liver cancer and liver cirrhosis. Thank you, Dr. Yu, for coming to the Care Online. See you next time.